It happened to me before.
With a male client?
Yeah, in university.
Oh.
So, nothing, no harassment or anything.
Yeah.
Just that the things he say.
Hi everyone! Welcome back to episode 5 of the Crackdown. My name is Kaye, lead chiropractor from Relief Chiropractic. Today I have another special guest joining me on the couch today, Li Xuan.
Hi everyone!
Li Xuan, you can also call her Sophia.
Yes.
Any specific preference with what you prefer, like clients calling you, or what do your friends normally call you?
Friends usually call me Li Xuan, but a lot of clients call me Sophia because it's easier to remember.
Yes, Sophia does sound really, really sophisticated and it suits you a lot, I would have to say. Li Xuan is one of our latest addition to Relief Chiropractic, joining me as an associate chiro. And just wanted to let everyone know Li Xuan has been such a helpful hand in the clinic. I'm sure clients who have been in, have seen her around, do know that she comes in with the warmest smile, with the most helpful hands, helping all of us in the clinic. Not just seeing clients, but also helping all of our other colleagues, and everybody loves you. I just want to tell you that. To start off, let's tell everyone about your background. You are a graduate of IMU in Malaysia. And what year did you graduate again?
I graduated in 2018.
2018. That's years of experience.
Yeah,
Coming in. Yes, yes. And the course was how long again?
4-year course and then final year of internship.
Okay. So internship includes?
Includes seeing actual patients under the supervision of a supervisor.
Okay. So that's quite similar. So it's 3 years of like theory and learning hands-on.
Correct.
But the final year is seeing clients.
So final year is half-half. So we have classes as well, and then also seeing actual patients.
I see. So you do graduate with a lot of experience hands-on with clients.
Yes.
And all that.
Because I think similar to you, we have to hit a certain number of patients.
Yeah, we did. So IMU also comes with a teaching clinic, in case some of you are wondering. And in order to graduate, you do have to clock in how many hours is that?
I don't remember the hours, but we have to hit 60 new patients and 300 follow-ups.
Okay, that
minimum.
Sounds similar. It's been a while since I graduated, but I do recall something like that. And having to log that in a specific, in a certain amount of time, like in a couple of months or something.
Ours were 6 months. I think 3 days a week we have to clock into the teaching clinic.
Same.
Yeah.
Yes. So you're seeing actual clients, and that does really help with applying the knowledge that you've learned.
Correct.
And before graduating, right? That's good.
Definitely.
And prior to joining Relief, you have worked in a couple of other clinics as well.
Yes.
In different areas, right? Not all in Subang.
No, different areas. I worked in Bukit Jalil before, which is IMU. And then I also worked in Damansara area. And then Subang.
I see. Have you noticed any difference in patients? Clients in different areas?
Yes, different areas, the clientele is a bit different. Personality also a bit different.
Right?
Yes.
I can't wait to hear some juicy gossip about different patients. Because where I used to work, I worked in Australia. And when I came back, I only had one job before I started in Relief. And then I've been like locked in Subang the whole time. So I love clients in Subang. They just feel, because I grew up in Subang, so it feels very warm. It feels like everyone is my friend and all that. But I never really got to experience like different suburbs. And I think, so 2018 you graduated, that brings you 7 years of experience prior to joining Relief?
Yeah, this will be the 7th year, I think.
What?
Yeah.
That's long. That's really long.
24, 25. Yeah, this is the 7th year.
Let's confirm this. This is a 7th year.
Yes.
And how interesting is it that Relief is, I think, 7 years old this year? Wait, 2017, 8, 9, 10.
Counting.
2025 minus 2017 is what? 8 years. No. 8 years.
8.
Oh, we're 8 years old. Okay. So, pretending I'm not your colleague and I don't work with you daily, how is it like working in Relief so far? How is it like, you know, like honestly, like how's the boss? Is she nice?
So far it's been good. I would say the team, I think it's a mature team because a lot of them has been working together for I think more than 5 years, right?
Yeah.
5 to 8 years already.
Yeah.
Yeah, so the foundation is there. So it's very easy to blend in also.
I hope everyone makes it easier for you to kind of get used to working in here because everyone is at this point kind of like furniture, like front desk, physio, and of course myself, we've been there for so many years. I think apart from you and Zul, which is another one of our newer additions, he's a physio and he'll be on our episode sometime in the future too to just let you guys know. Yeah, everyone has been around for long, so I hope you feel at home.
Definitely.
And ease into it. This is your 4th month?
Yes. No, 5th.
5th month!
Yeah, 5th month. Wow, very fast. 5
How
months already.
quickly, yes! And already you're building your base. To be honest, when we were looking for a new chiro, one of the reasons why Li Xuan stood out was because of her very special focus and her certification in Webster technique. Can you tell us a little bit more about how you got into Webster and also introduce to the public for people who might not know what Webster is?
Okay, Webster technique is a type of chiropractic adjustment that focuses on pregnant ladies. The main goal is to ensure that the pelvic bone is in proper alignment and that the muscles are balanced so that there's less irritation on the nerve. So it's different from conventional chiropractic adjustments where there's a lot of high force rotation. So Webster is very safe, effective and gentle for pregnant ladies.
I'm sure that's one of the biggest concern for somebody who's pregnant also, when they still have back pain and in their head like, I'm not going to see someone that is going to still crack me like in the videos, like smack down like that, right? Like wrestling like that.
Yes.
So it's so reassuring for somebody who's pregnant who know, oh, there's actually an alternative technique.
Yep.
And of course, to see someone certified, it just gives them a peace of mind. So is there any specific focus when it comes to Webster technique? Because it's obviously focusing on pregnancy. How does it differ from, like, say, a regular layman with a low back pain?
Okay, the approach is different also. For pregnant ladies, there's no rotational adjustments, there's no high force manipulation. Everything is done in a very specific and safe manner. So most pregnant ladies, they'll be lying face down and treatment done is all gentle back to front kind of movement.
And they have like a special pillow
yes.
to also fit the belly in.
Correct,
For people who are concerned, because of course when you're pregnant, it's not good to fly face down on like such a hard table that adjustment are usually done on. So we actually do have a belly pillow.
Yes.
But I have patients who are not pregnant who also enjoy lying on it because it's so comfortable. Is there any specific reason why you got into this chiropractic care focusing on pregnancy that is at Webster?
For myself, by experience in university, I didn't have a lot of exposure to pregnant cases. Like in our syllabus, we cover a lot on MSK, neurological conditions, even autoimmune disease. But when it comes to pregnancy, very limited knowledge on that.
Agree.
So when I came onto the workforce, whenever I have pregnant cases, I feel like I don't really know how to give the best care. That's why I decided to do Webster technique.
And there's also a demand.
Correct,
isn't it? Because so many people think that having back pain or groin pain during pregnancy is like parts and parcel of being pregnant. But what if there's actually a way to reduce it? And on top of stressing about the pregnancy, the last thing you want to do is stress about back pain. So it's so good that there's something like Webster that allows that to happen. So how do we replace the rotation aspect with a gentler technique? Like how can we make it still work?
So when it comes to adjustment, patients will be lying face down and the bed they will use will have an adjustable drop. Yes.
Drop piece.
The drop piece, correct. So with a face down position, we'll just drop the pelvis region, or if we don't have, we'll use an activator.
Okay. So all these are lower force, gentler alternative to the crack. The usual crack that we hear. I see, that's interesting. Since being certified in Webster, have you noticed a demand in low force techniques as well?
Yes.
Yeah.
Especially nowadays, you're getting a lot of younger chiros are also doing Webster technique. So the exposure is definitely there. Yes. And because of that, a lot of patients, pregnant ladies are also coming in seeking for this type of treatment.
So the awareness is already
Correct.
there, and a lot of maybe fresh graduate also know of this technique because it's
Correct.
so easily accessible now. So that's so good. I think at the end of the day, the patients are the one that win. You know,
Correct.
yeah, the lesser back pain, the easier pregnancy you have, and obviously, hopefully, does Webster also help with like the delivery process of it all, or is it just mostly like to help with pain?
Mostly is also help during delivery. So the main goal essentially is to help reduce pain, but also to restore function into the pelvis movement. And also with the proper functioning pelvis, the baby also have space to move better. So essentially, it also helps with the delivery process. Some patients reported a faster labor time, but of course it's case to case basis lah.
Yes, that's such a great peace of mind. Is Webster technique able to turn a breech baby? Is that something? No.
That's a common misconception. A lot of people think that we can turn babies, but actually we don't. We basically create an environment where the baby can move better.
Okay, so it doesn't feel so cramped in there.
Correct.
I think the two men don't know what is breech, right? They're like, what is it? Because the hip is the foundation, right?
Correct.
So let's just say if you're in pain, the hip is misaligned or if it's twisted, the space on top will be narrower. If the foundation is not like firm and solid, then the baby cannot really be comfortable. That's like what I'm thinking in my head.
Correct. That's the concept. Because when the joint is stuck, right, the muscles will tighten up also in certain areas.
So it'll
like cramping. When you're pregnant, you definitely can see a chiro, but it's good to see a chiro that's either Webster certified or has a lot of experience in treating prenatal cases. If you find a right chiro, the treatment actually is safe. It's not dangerous.
I think it's similar to seeing any healthcare person that is lacking of experience. There will be aspect of things that maybe they haven't come across or maybe they're not confident in. So if every like person A, person B, person C with different body type, different pregnancy or not, you do the same thing, then of course somebody will suffer.
Correct.
That's what I would imagine.
Yeah, that's why when it comes to managing pregnancy cases, right, different stage of pregnancy requires different type of approach. Yeah. So if a person that's coming in with probably 4 or 5 past deliveries, then the approach will be different from someone who is a first-time mom. So it's very case-to-case basis.
So I suppose the certification that you have, Webster to be specific, they also kind of drill it into you what to look out for in different stages of pregnancy. Is it your first pregnancy? Like what does the body normally require at different phases of pregnancy?
Yes, because someone with prior pregnancy, right, maybe in the first pregnancy they experience this. So in the second pregnancy, that's what we want to look out for. They make sure they don't experience that.
Is it common to experience the same thing?
Sometimes, yeah.
Just how the body
react.
Okay. Because I do get clients who are pregnant and they are concerned sometimes if they are maybe a bit bigger, maybe second to third trimester, and maybe the baby is like slanted to one side. And they do wonder, like, is it because I sleep on one side so the baby is like there? Is it an issue? Or it actually causes pain because the heaviness is on one side. So is that something that Webster could help as well? Not to turn the baby, but kind of ease the baby away from camping at one spot. Yeah.
It can, because then we have to check and see what could be causing it. Either the baby's feeling more comfortable that way, or it could be a restriction in the pelvis that's causing the baby to react that way. Yeah, so we have to dig deeper and see overall the spinal pelvic alignment, how is it?
Okay. So is it possible that, let's just say, the right hip is stuck and that's why the baby is there, or the baby is away from the stuck joint, or it could be either?
It could be either way. It says how our body reacts to it, how the mom's body reacts to it.
I've got friends and clients who are pregnant also who have told me they have mixed opinions from their gynae about sleeping on their back.
Correct. Yeah.
The traditional advice is never. But there are more and more gynaes now that say if it's comfortable, just sleep on your back. Nothing too bad will happen. If something bad were to happen, you would know before, like you would actually feel sick, and that would prompt you to be on your side. Is that what you think?
Yeah, that's what I think also. Because at the end of the day, rest is very important. If you're forcing yourself into a position that it's not comfortable, you cannot sleep, then you also cannot recover properly.
Exactly, because what we do notice is for people who maybe are so used to sleeping on their back, and all of a sudden, because of traditional advice and all these things, they're on their side, they start to develop pain somewhere else.
Yeah, correct.
In their neck and their shoulder, and then you have to then go and treat all those
Additional
areas.
issues.
Yeah. So Webster technique, of course, it covers the hip area the most, would you say? Hip lower back?
Yeah, hip, lower back, as well as the muscles, ligaments surrounding that.
Okay. So for people who come in maybe first, second or third trimester, doesn't matter, the rest of the body can be adjusted manually, would you say?
Yeah.
So as per usual.
As per usual, just the low back, pelvis region, no rotational forces.
Okay. So I hope that answers some of your questions, because we do get asked that quite a lot. And post-delivery, how soon do you think they can come in and get treatment? Is it important that they come in for treatment even if there's no pain? Or would you say, cannot tahan then only come?
It's good to come in because once you deliver, your body also goes through postural changes from nursing, from breastfeeding, this kind of thing. So definitely a lot of patients, they develop neck pain, mid-back pain as well after delivery.
Right.
And so it's important to come back as long as you're ready. So if let's say you have a cesarean, then usually once the wound is healed, after 4 to 6 weeks will be a good time to come back. With a natural delivery, some patients come in as soon as after 1 to 2 weeks.
During confinement already.
During confinement, they come in.
I see. And will they still be treated with Webster technique after delivery, or it can be
It will
introducing manual, more normal type of adjustment already?
You'll be back to normal adjustment already.
Okay.
We'll have to check if the pelvis is too unstable, then we don't want to do too much rotational also.
It's very interesting because for people who might not know or might not be familiar with chiro, rotation is actually a big part of our adjustment.
Correct.
Yeah,
Yes.
rotation sideways is basically the videos that you see where people lie on their side and then somebody on top just no, not that is like really smack down already. That is actually a big part of our treatment, and there's a reason why we put patient in that position, because it does help open up the back. And I feel like personally as a chiro, I feel like minimal force is required to make a change in a very locked joint. And as the spine goes down, so from neck all the way down, the joint naturally is stiffer with good reason, because it needs to protect your body. So in order for the lower back and hip to move, lying on your side and introducing slight rotation is the easiest way and most comfortable way for the patient and for the practitioner to do. So when you remove the aspect and you feel like, okay, you can't rotate anymore, you do need very professional care in that area to still achieve the same results. We still want joints to not be locked, but on top of that, because of the pregnancy, we need it to be stable. There's no leeway for chances of more pain or the pain to spread somewhere else. Like, that's the last thing a pregnant mom would want.
Correct.
Yeah.
Yes.
So from my understanding, because I'm not Webster certified, so this is such a good session for me to learn. So for Webster, I think SI joint is the main focus. SI joint is basically the joint behind our hip. And then pubic area and groin area as well? Okay.
Pubic area, groin area, the muscle at the glutes, as well as the ligament that holds the tailbone to the thighs.
So
these are the main areas. Correct. The sacrotuberous ligament.
Okay. Got it. So those are basically like the building block for a good foundation for the hip. So those are the things you look out for.
Correct.
So there's actually like a checklist that you go through.
There's a checklist. So how we do is there are a few orthopedic tests we do to ensure that the patient is Webster positive, and then based on our findings, we'll do the treatment accordingly. But the main focus is the bone muscle ligament, which is the tree at the back, SIJ, piriformis, and the sacrotuberous ligament. And then from the front part will be also the bone muscle ligament, which is the pubic symphysis, the hip flexors, and then the round ligament.
So those are the checklists that you have to go through in order to determine if someone is Webster positive or not.
Correct. Yes, but that is like I would say a small, but that is just a part of Webster technique. We also teach patients how to do certain exercises that are suitable for them, like gentle exercises. So that is also part of the whole treatment plan.
Yes. I don't know about other clinics, but at least in Relief, we work with physio very closely with that reason, because we don't believe that somebody can just come in and get cracked and leave and things will stay good.
Yeah.
Yeah, they do require some form of rehab. And for pregnant women, it's the same. Just because you're pregnant doesn't mean, you can't move and all that.
Yeah.
Sure, there's also another misconception that some of the patients have. They don't really dare to exercise.
Correct. So the whole thing about Webster is also not only to help with pain, right, but to also help patients gain the confidence to move better. Because like you said, a lot of first-time moms, they don't dare to do a lot of things.
Yeah, because they don't really know. Like maybe they used to run a marathon or they do very high intensity work.
Correct.
So they don't know what are the good alternatives. Yeah, so that's when somebody who's certified in Webster can give you more detailed advice on that. What can actually not only make you feel better, but it's actually good for you and good for your pregnancy. Thanks for that. That's really good information, and I'm learning so much. So how has the journey been for you so far after being Webster certified and seeing pregnant women? Do you actually feel like selfishly you wish to see more pregnant women so that you don't have to exert so much? It must be so easy on your wrist.
Yes,
to not have to
definitely.
boom, right?
On the back also no need to kick so much, yes. But to be honest, I actually enjoy treating MSK also.
For those who don't know, MSK is musculoskeletal cases, which means like your neck pain, spine pain, joint pain, that type of
Yes, or even sport injury, just to keep a variety lah. So it's more interesting at work. Yeah.
That's our bread and butter anyway, so that we should really know that also, right? So from time to time, seeing some Webster cases and some MSK cases, that's your preference.
Yes,
so,
a good mix will be good.
I see. And kids, what about kids? I guess I'm seeing the kids then.
Dr. Kaye can see all the kids.
I love seeing kids, honestly.
You have a few kids, I think, a few young patients also.
Yeah,
Baby as well, right?
I do, yeah. I do see babies. Actually, some of my clients also are pregnant cases, and the treatments are also tailored based on their needs. So I think some people might be quite confused, like, is Webster technique like compulsory to treat pregnant women, or is that preferred? Because I am not Webster certified. I have gone for seminars and all that for pediatric and also pregnancy related courses, but I wouldn't call myself anyway certified. There was no exams taken, there was no one who judged me and gave me a cert, so I don't want to go out and say I am like a professional in all of this, but I have had experience treating clients. All in all, you just have to be extra careful, and every step of the way getting the feedback from the client. Yeah, are you still comfortable? Do you want to stop? Or even with the comfortable pillow that we talked about, some people still don't feel good. It might not be the belly, it could be the hip, it could be the breast, like something just makes them not feel right, then we stop. I think it's important that we constantly get feedback from clients, right? Back to kids, so that's just like a no for you. Okay, is there a reason why?
I'm not very good with kids to begin with. Yes. So the youngest I treated was, I think, 11, recently 11 years old.
Yes.
Still okay. 11 still okay, but any younger than that, I don't think I can.
Is it like the communication?
I think it's more of the communication, and they're very hyper, very active. Yeah.
Wait, but from my understanding, you are the oldest of among your siblings.
Yes, I have two younger sisters.
So, you have two younger sisters. So growing up, they traumatized you. That's why you traumatized me.
Probably some childhood trauma.
Interesting. Because I do find that, of course, there are kids that are a little bit more difficult sometimes. It's hard to get their attention. It's not that they are difficult. It's just hard to communicate. But when they do get it, it's the best thing ever. Yeah, and to see like a little kid, knowing the right posture to do, or like to get help when they have random sprains, or that they think about you when they like hurt their knee and all that. That is actually quite cute. And also I think if for them to have that awareness from a young age is also not a bad idea.
Yes, very important.
Because growing up, did you know much about this as a kid?
You mean about chiropractic or about posture?
A chiropractic and also like alternative care, I would say.
No, actually, I think I've only known about it when I was in college. quite... Of course, Chinese medicine, all we know when we're young lah. But like chiro, Tita, all this, I only found out about it later on.
It's so interesting, isn't it? Like we know conventional medicine, like okay, when you have a fever, you go to the clinic. We know about TCM
Correct.
a bit, but everything else is like a blank.
Yeah. Only in college, only I found out about chiro, about Ayurvedic, about a lot of other traditional homeopathic, osteopathy, all also only in college I found out.
It's so true, but I think it's changing now. Yes, it's definitely changing now because kids, we have clients maybe around like in their 30s or 40s bringing their kids in now. And the next generation is going to be a lot more aware of all this, which is such a good thing.
When I first started practicing Webster technique, I had a patient that came in, she's a bit older, I think about early 40s. So this was her second pregnancy after I think a 9-year gap. So at that time, she had very severe SIJ pain, so like tailbone pain. So she couldn't sit. Whenever she lie down, she also feel pain. Basically, any position triggers the pain. Yeah, correct. So it really affected her mentally and emotionally as well, because she couldn't go back to normal activities. So after a few sessions of Webster technique, including a bit of physio to help with the tense muscles and also to teach her how to engage the right muscles, then over time she started getting better and she can sit, she can move better. Yeah, so essentially, it's also to help them build confidence, like I said, for them to move throughout daily life. And her delivery was also very smooth. That's one thing. Because she struggled in her first delivery. So natural birth, poop, baby came right out.
That is like the best thing ever.
And I remember very clearly because she came a week later after delivery, she came with her baby. So that was really very fulfilling.
That's amazing. Amazing.
Yes. That was probably the most I can remember. The most not dramatic, the most extreme one I can remember.
Because of course you worry for them too.
Correct.
To be in so much pain.
And when she came in, she was very distressed also. So that also made me realize how much it is affecting her emotionally as well.
Yes. To have pain like that you can't do anything about, I think that's just a very terrible thing to go through.
Correct. Very frustrating for her also. Because she also don't want to take too many medication. Because her obstetrician was telling her to just take medication to help, at least she can rest better. But she doesn't want that.
Do you think the gap that she had between the two pregnancies played a role, or her age played a role too? Is it something that like for older mums would experience more pain or not really?
I would say it's more of the lifestyle. So if you are active before you got pregnant, you are already very aware of your posture and you are very you do a lot of exercises, deep core exercises, pelvic strengthening. If you're aware of all this, then the chances of pain is a bit lesser. So for her case, she's very sedentary. So that's probably what made it worse as well.
I see.
But of course, when it comes to pregnancy, that is not the only thing. Sometimes it's also the hormonal, how the body reacts and all.
And that is the part that we cannot control.
Correct.
Because as much as chiropractor, whether you are so experienced in Webster or not, there's probably one thing we cannot control: hormones changes.
Correct.
We can just keep up with what the hormones are doing to the body and try to calm everything down, but we can't make certain hormone come up or go down.
That's beyond our control already.
And it's something that we shouldn't tamper to. So it sounds like it can be so rewarding when the results are amazing. But it can also be very stressful going through that with them.
Correct.
Going through the pain with them. What about other MSK cases, musculoskeletal cases? Is there any very memorable treatment that you've done with them that stuck with you all this while in the last few years of your practice?
There was one case that was very impactful. So I had this patient that came in to me also a couple of years back. He had very severe gluteal pain and a bit of sciatica going down the legs. So when he came to see me that time, he has been struggling for 2 years already with that kind of pain, and he couldn't run. And running is very important to him because he is also diagnosed with depression. So he has chronic depression, he takes medication, but running is the only thing that helps him overcome that, or helps him cope with that. So for the past 2 years, he couldn't run, and it affected him emotionally, mentally. When he came to me, you can see the eye bags very dark and then very gloomy. The whole atmosphere is just very dark when he comes in. And he has the anxious type of personality. Yeah. So when he came in, a lot of those negative energy. So with every session, right, me and my physio, we work very hard to try to identify what is the root cause and to try to help him through it.
Yes.
So over time, I noticed within 1 month, within about 4 to 5 sessions, his condition improved a lot. He could go back to running.
Yeah.
And not only that, because he can run, then mentally, emotionally, he also looks a lot better. So after the whole session, he was very grateful. He sent a very nice email to me and my colleague, brought us out for lunch. So that was something that really impacted me because it made me realize that we are not treating just the pain. A lot of times we are treating beyond the pain.
Agree. And what the 15 or 30 minutes we spend with them actually has such a lasting impact and it affects other aspects of their life too. Yeah.
Yes.
I think you could agree with this when we spend some one-on-one time with the client in the room. A lot of the times, a lot of people have struggles with their mental health too. And we are not mental health experts. But the littlest things that we can do or the things that the attention that we can give an ear that just listen actually helps them feel a bit better.
Correct.
Yeah.
A lot last time when I was uni also, I think one of my lecturers told us like a lot of times when it comes to one treatment session, right, then 5 minutes adjustment, the other time is just talking and then helping them go through their emotions, someone to just talk to.
Yeah.
So it's like part-time psychology.
It's true. Without the proper training.
Without the proper training, yes.
There's no advice, not much advice given, we just listen.
Just listen.
Yeah.
Sometimes we just want people to talk to.
Yes, because it comes hand in hand, like the mental stress and the physical stress actually comes hand in hand.
Yeah.
And if mental health is something that you are interested in, please let us know as well, so we can maybe get somebody experienced in that field to shed some light.
Do you have any interesting cases?
Interesting cases, I have so many. I think I talked about a couple in like first episode. Some funny story. But mental health, yes. Yes. I do have a couple that, like you said, when you are able to help them, it's great. It's sunshine, it's rainbow, it's all of that. But we are not robot, right? There'll be times where we try our best and maybe things just don't work out, and it does sometimes weigh in, and I bring that home with me, and the people around me is like, what's wrong? I'm like, I don't know. You just feel guilty, like even though maybe you've done your best, but you can't do that. There are a few cases like that is stuck with me. And of course, when we do see them from time to time, it's fine. At least you get to check in on them. But being in this field for so long, there will be cases where people come into your life and then they just disappear. Like people move on. So you sometimes wonder, like, I wonder how is Mr. So-and-so doing? How is Miss So-and-so doing? Like there are, like some bedtime thought, like, I wonder how is he doing? I haven't spoken to him in so long. How is he doing?
Yes.
Yeah, there are cases like that. But funny stories, funny things usually happens like when you least expect it, I think. And at the top of my head, it's usually like people who are a little bit older. Yeah, people who are a little bit older that, I don't know, like farts or... yeah, so they fart or like they tell funny stories that, you didn't really ask for. Yeah. Okay, if you can bring yourself through back to 10 years ago, that is when you just started,
yes.
studying. Do you envision yourself here 10 years later, going through a pandemic and all of that, and sitting on this couch right now?
I would say, I expect myself to still be a chiropractor, but then I wouldn't expect the job to be this fulfilling, I would say. Yeah. Okay. Because actually, when it comes to my chiropractic journey, right, when I was at my 4th year of university, during internship time, I wanted to give up. I didn't want to do chiro.
When you were so close to the end?
Yeah, so close to the end, but I realized it's too late to quit, you have to just do it. Yeah, reason why is because I feel like I could do more. I feel like I wanted to do more for the patient. I felt like it was very limited what we learned in uni. But once I started working and I started collaborating with different healthcare professionals, I realized that actually what we do is we can do a lot more for the patient actually, not only just adjustment. Yeah. So it starts to widen my perspective a bit.
Okay.
So when I started practicing, that I start to learn and to love the profession a bit more.
When you were on the brink of giving up, you thought that it would just be like cracking.
Correct.
Oh.
Yeah, because in uni that was what we really focus on, technique, adjustment.
Right.
Yeah, so when I first started practicing, that was also my main focus. Adjustment has to be good, which is important.
Yes.
Yeah. But when it comes to actual practice, right, you also build a lot of connection with people.
Yes.
And then you tend to get involved in their lives in other aspects also.
Yes.
So that just made me feel a bit more fulfilled.
I completely agree. Like it suddenly feel like, oh my god, I'm learning so much every day from this person that
Correct.
I would never have crossed paths if it wasn't for them having back pain. Yeah, that's how I feel too. Because there'll be days where, of course, we work for so many years, there'll be days where we're like, I need to go to work again today, like crack again and all that. But these unexpected things will happen and then you'll be like, oh my god, I'm learning a lot from this person. I'm learning about myself,
Correct.
how comfortable I am with work and all that. So lucky of me that you didn't quit. But let's just say if you did quit, it really got to you. What do you think you'll be doing now?
I probably go back to studying again. Study some medicine or some other healthcare course.
Because you feel like you want to be able to help a wider range of people.
Correct. Not just adjustment. Yeah.
Okay.
Like not just back pain. Yeah.
So what made you pick chiropractic as a profession in the beginning? Like to pursue as a in uni?
I like the idea of holistic healthcare. I like the idea of being able to help people without medication. But of course, during study, I realized, there's actually a limitation. So that's what that gave me the feeling that I wanted to quit.
The ick.
Yeah. But once you understood it a bit more, then you start to appreciate what holistic healthcare is. And nowadays, I think in Malaysia, we're getting more and more awareness about holistic health also.
Yeah.
Getting more and more wellness based.
Because when I came back from Australia, of course, I worked in a clinic where there was integrated health. So I worked with a naturopath, a Chinese medicine, a massage therapist, a kinesiologist, like the energy and all that. So it was really cool. But when I came back, I was shocked that people don't really know about naturopath even, or homeopath. But as of recently, they can really see the transition. Like people coming in, telling me that they already seen all these people. They already have like a program going. So I hope that continues on because that's amazing. Like the more knowledge you know about your body, that doesn't necessarily always need a vitamin or a Panadol or any sort of medicine to fix. The more you actually pay attention to it, the more rewarding it will be for your body. And I think chiropractic is a good first step.
Yes, it's a good first
So now with the previous, how many years of your experience? 7 years of experience. You've mastered that. Of course, additional studies will be great if you feel like you want to
venture a bit
other
more.
things. Yeah. And when everything comes together, it'll be so good. The value that your patient get from seeing you will be like so much. I can't wait for that for you. Is there anything in particular you think you want to pursue? If you could now?
Currently, not at the moment. I can't really think of one at the moment.
I think you'll be great in psychology.
Psychology,
Because I feel like she's very steady. Yeah. Even when I remember when I first met you for interview, I was like, how old are you again? Because you bring in this very steady, mature energy. Yeah.
Maybe I can. I'm actually interested in like psychology also.
Yeah. I think that'll be a great addition to your
to the whole practice, to bring more value to the practice.
Absolutely. It's for yourself as well because you already have the upper hand of being like very steady.
I try to be inside, outside only steady.
But at least you hide it very well, which is not something I can do. I go outside also, inside and outside. What's the weirdest reaction you've ever gotten when you told someone that you're a chiro? Weirdest, or I suppose what's a common reaction?
Common will be, so you just crack bones? That's Yeah, a lot of people only think that chiro just crack bones. They don't know what we do actually with the assessment, the analytical of the posture, the spine, the muscle. They don't know all those.
Yeah.
They always relate us to theta.
So any problem that you have, just crack it and it'll go away.
Correct.
They think that's what we do.
The
I
common
wish it was so easy. Then the session would just be 5 minutes.
Yeah, then bye-bye, 5 minutes.
Oh, get out the door. No, it's not. I don't think we need to study 4 years for that. If that is
Yeah,
the case.
exactly. Chiropractic is a lot more than that.
It is. If you could go back in time and give your younger self one piece of advice before starting this career, what would it be?
I think when I first started off, I think my mindset was very limited. Yeah, very limited to what I can do, how I approach patient. I try to be very serious with every patient because I want them to, I think because chiropractic at that time is still very new.
Yeah.
So a lot of people have they're very skeptical about chiropractic.
Yes.
So you try to present yourself as very professional, very white coat, that kind of thing, just for them to trust you a bit better.
Yeah.
But I think recent years, I feel like I should just let go, don't be too serious, and then try to build rapport and just educate people.
Yes. And it comes with experience too.
True, kind of experience also.
When we're younger, we always get like, you can or not. First of all, you're a girl. Second of all, you're so young.
Correct,
Third of all, you're so short. Bang, bang, bang. Like, okay, give a girl a chance, you know?
Correct. Yeah.
So you feel the need to like peacock a bit.
Correct.
So like,
Put a
I
bit more
can do
effort.
this, trust me, right?
Yes,
And now it's like, I don't care, you believe me. You know, like you want lie down, don't want get out.
Yeah, now something like that. Oh, you're not so good.
Yeah.
Something like that.
Yeah. This is like layman. But on the inside, sometimes you do feel that way because if you already call to make an appointment to come in, our data is all online already. Like you can see how I look like. You can roughly guess my age already based on how I look and like the year I graduate and all that. So if you still decide to come in, then you know, don't be so hard on us because we have a lot of things to do. Yeah, our priority is make you feel better, not to like show off my CV and like, no, trust me, I'm the person for this job. Like, no, don't waste time doing that. Let's work on getting you better.
Correct.
Yeah.
So I think the advice would be to have more confidence in myself and to continue to improve myself, like in knowledge. That's what we can do for our patients.
Yes, because at the end of the day, we're there to help.
Correct.
And that might not necessarily be cracking. It could just be advice. It could be pointing them in the right direction. It could be, so many things. I remember when I was studying in Australia, there was actually a special class, like an after-school class kind of thing for female chiro, and teaching us how to treat not only larger patient but also like male patient. At the same time, protecting ourselves. I thought that was really cool. Yeah, because a lot of times we are so in such close contact with them, and of course, it's important that we feel safe. We don't feel like things like that could happen. I don't know. Has it happened to you before?
It happened to me before.
With a male client?
Yeah,
What
in
happened?
university.
Oh.
So, nothing, no harassment or anything.
Yeah.
Just that the things he say, it was very uncomfortable.
Yes. Is he old?
Not really old, 30 something like that. Yeah, like he keep telling me that, can you come to my house and do adjustment for me? I don't have to come here, just come to my house. I pay you more. Things like that.
Yeah.
It happened. First time I just ignore, but it keep happening, right? Then I got a bit uncomfortable.
Yeah.
So I refer him to my male colleague. And then immediately he stopped coming already.
Yeah. Oh.
Yeah. Then, you know something not right.
Goodly. Okay.
Really, correct.
Oh, I've had a couple of cases like that too. They might not physically do much, but the mouth just like, so nice lah. If can marry someone like you every day, you can crack me in bed like that. I was like,
Correct. Get it a lot.
oh my gosh. And they're married. Stop it! Oh my god, don't do it, okay? Tell your wife.
If you got male chiro, you can refer to male chiro.
I used to have one.
Is it? Oh.
So also sometimes they just stop coming or they will come up with an excuse like, oh yeah, I used to you already, like that. And of course, most of the time you're alone with them in a room. So you have to be alert. Yeah, so for female chiros or maybe students, please take note of that.
Yep.
Yeah, you have to be able to protect yourself. We don't want to wait until it's too late or that you feel violated, whether it's mildly or severely, then only do something about it. Yeah. Before we end this episode, let's go through a few rapid fire questions just so that our audience get a chance to know you better.
Okay.
First one, are you a morning person or a night owl?
I'm a morning person.
You're a morning person. So, Mr. what time do you wake up in the morning when you don't have to work?
I don't have to work around 8, 7, 8. Is that considered morning?
It's considered morning. Okay. Are you one who would correct them? Let's just say friends and family.
Oh yes, I
Would
will.
you will?
Yeah. I will just hit the tap. Usually they use the phone like that. This is the main one.
You would. Interesting. Okay, dream celebrity patient you'd love to adjust. Anyone famous that you feel like, oh my god, if I could touch their back. If I could crack their back, that would be amazing.
Kendall Jenner.
Oh, wow.
First thing that came to my head.
One snack you always reach for. The question says after a long day, but I'm more interested like what do you snack on throughout the day when you're like in between clients?
I think because our center has a lot of the Lexus biscuit.
I love
the
Lexus.
chocolate.
Yeah.
So I always take that.
Is that
in
your
between.
favorite?
Yeah.
Yeah. I think
chocolate
that's a
sandwich
good pick me up. Yeah. Okay. That wraps up our rapid fire round and also wraps up this episode. Thank you so much for joining us today.
Thanks for having me.
I don't know when we'll have another Chiro in to have such a detailed chat with us. So I hope you enjoyed this episode. And if you have any questions about Li Xuan, feel free to ask us in our socials. And we'll see you on the next episode.
Yep. Bye. Bye.